probably will. Yeah. Is that it? That's all
Yeah.
it was.
Yeah.
Huh?
Wow.
Welcome everyone to the meeting
Yeah.
for Wednesday, September 7th.
Yeah.
We will start off with Health Services Committee.
Good evening, everybody. We will open up Health Services Committee meeting at 6:01 p.m. Resolutions to get through. Authorizing agreement, Greene County Family Planning and Patricia A. Lawley, RHIT Medical Records Consultant.
Davis.
Davis, Hobart, all in favor?
Aye.
Opposed? That's carried. Authorizing agreement, Greene County Public Health Department and Patricia A. Lawley, RHIT Medical Records Consultant.
Davis.
Davis, Hobart, all in favor?
Aye.
Thanks, Harry. Authorizing agreement, Greene County Public Health Department is SUNY Delhi. Hobart Bloomer, all in favor?
Aye.
That's carried. Authorizing agreement, Greene County Family Planning and Excelsior College.
Davis.
Davis, Bloomer, all in favor?
Aye.
Opposed? That's carried. Amending resolution number 260-21, Greene County Family Planning and New York State Department of Health Family Planning Program, contract number C36272 GG.
Davis.
Davis, Handel, all in favor? That's carried. Is there anything else to come before Health Services Committee this evening?
Matt has one.
Yep, Mr. Chairman, we have a guest that would like to address the Health Services Committee. I'd like to call Mary on Hernandez. She's a Catskill resident.
Come on up.
She has a couple of concerns she wanted to bring to our attention.
Don't be afraid.
Yeah.
We're friendly.
I worked for quite a while at the Early Childhood Learning Center in South Carroll. I don't know if any of you are familiar with it. It was an absolutely wonderful program. We evaluated children from birth to 5 and provided services. We worked very closely with the early intervention program, which was birth to 3, with Kate Izzo, and they did a great job. And we, excuse me. And I recently had someone ask me about a child they knew who they felt was not progressing as they should. And I said, well, you can always take them over to early childhood for an evaluation. I found out there is no early childhood anymore. I'm sorry, it was very, very upsetting to me that the program was gone. The people in the building are only involved in Head Start, which is a great program in itself, but it's not what we did. And to get an evaluation, I spoke with Mrs. Clark at the early intervention, excuse me, at the public health nursing. And I was told that to get an evaluation, it would take probably at least a month. And sometimes parents of young children are concerned about evaluating the child. And I'm sure you can all understand anyone that has a child. But if you get these children when they're young, you can do so much for them and with them. We had absolutely amazing staff. We had a physical therapist, a number of speech therapists, which is the main concern for young children. Occupational therapists and occupational therapy assistants. We had special ed teachers. It was just a really amazing program. I have to say, I think it was one of the best in the state. And it was funded by federal and state funds, so it really wasn't coming out of the county. I mean, there was probably some paperwork, but I don't think it was that much. And I'm just distressed that a child would have to wait a whole month before they even could be considered for an evaluation. Then they had to go to either Kingston or Albany. And a lot of people, parents may not be able to do that easily. I'm sure that public health would probably provide some kind of transportation if they needed it, but I just am so unhappy that this program is not here. It was such a wonderful program, and there's so many children that need it. We were full. We had 2 classrooms in South Carroll. Plus, we also had a typical nursery school where we did, we put the children in both so that they all got familiar with. And, you know, the typical children worked with the children that maybe had special needs. It was a great program. And we had so many children, we opened up a site in Athens at one of the churches. And that was full also. That's just for the children that needed in-house programming. But we also saw many, many children at their homes. If they only needed speech therapy, well, we go to the house. If they only needed physical therapy, same thing. Same with occupational therapy. We also had an on-site psychologist, and we did evaluations twice a week. We set them all up. We did an evaluation with every discipline, evaluated the child. And we figured out transportation if that was needed for the parents to get there, which wasn't often, but sometimes. We also took children who needed to see doctors to Albany if they needed to go. The parents weren't that able to take them. And trying to think if I left anything out, but the point is, why is it gone? I don't know. I haven't been able to find out too much. I spoke to someone who still works in the Head Start program over there. And she said that after B. Reese, who was an amazing director, we also had an amazing board of directors. When she left, they hired someone else, but she didn't last long. So I really don't know too much about what happened or why it's not here, but I think it's such a tremendous loss to this county not to have it here, especially the evaluations, because you're asking people with little children, sometimes they have more than 1 or 2, to go to Kingston. You have to wait a long time to get there, or Albany. And it just was such a great program to be here, a great opportunity for children to be evaluated and get any services that they needed. And we had so many success stories. I see some of them around now, and they're just amazing. So that's about my spiel. If anybody has any questions, I'd be happy to.
How old was the child in question?
6 months. We always said we did birth to 5, but only once. I had a doctor call me about someone that was just born.
Early intervention is birth to 3, but you
That's
say
really
it
good,
takes
yes,
3
but
months to get a
our-
therapist or to get a case manager?
Oh, no, it's to see a therapist. Yeah, but we worked very closely with the early intervention program. We did all their evaluations. And as I say, Kate was great. Kate was in charge of the program.
Has the child being evaluated?
No. And the other issue is sometimes parents don't feel comfortable about going somewhere else. They don't mind coming to South Carroll. It's not threatening too much, but they don't necessarily want to go to Albany or to Kingston or somewhere else. Remember, these are parents of very little children. And but
Was this a private office doing this, or was this a county office that was doing it at that time?
it was private nonprofit,
Private or nonprofit?
yes,
So,
but we got paid from the state,
Right,
from
yeah,
the
no.
county, but it was from the federal government and the state.
well, you know, like public health used to do at-home care as well.
Oh, yeah.
It hasn't done that in many, many years.
Right.
I was just wondering if it was under the same type of thing that was. It's apparently not. This is a not-for-profit.
I believe they still have therapists that work with the early intervention, but I don't know enough about it now as I did then. But
I mean, we're still doing some of those services, but we're doing it more through Laura's department, public health. But I don't think it can, I don't think it can come to the level that a private company could do.
We
just
were a
because
company, but
we don't have the, well, we're not profit.
yeah.
Just speaking from experience, Pat, like when my boy's son was like 0 to 3, we had him evaluated. And when he had to go to school, if you provided writing to the school, they have to evaluate. I forget, it was like binder or binder versus something. There's a federal law where the school has to provide that service. I mean, we found that out after we had to pay. And we went to Albany, Schenectady, and a couple other places to do an evaluation
That's once they're in school.
I was gonna say. we
before
did
they
it
would
for
let
6
them,
months.
right, to go into school. But
Before they went. to
right,
school,
but when they were in kindergarten, there was a couple telltale signs or whatever, and
Yeah, this
They
is
brought
6
it.
months.
right.
Yeah,
I
sometimes we don't
thought
pick it
we
up.
just approved some resolutions with this.
We do, but it's related, I think, more to school age kids.
Now, the schools provide pre-K.
Right. That's what I thought we just
They do,
approved
the
it.
schools do
One
provide
from
pre-K
Catskill and then one
special
from Carroll.
education.
We work through with all of the school districts in the county.
But it's
They-
pre-K,
Yeah.
4 years old,
Yeah,
it's not
3 to
6
5.
months old,
Well,
right?
my daughter at 3 years old got speech therapy. And it went through the Greenville school. And a matter of fact, I served for a year as a parent volunteer, special education pre-K advocate. Sat in on multiple they called them the evaluations, but they were not the evaluation of the child. They were the evaluation of the course of action that special ed would go to for that child.
Laura, anything you want to add here? I don't want to put you on the spot because
I mean,
it's kind of off the cuff, but
we are also very saddened by their closure. It's a huge loss for the county and for the early intervention program, which relied on them so heavily. I don't know why they had this closure. My guess is that there were huge impacts related to COVID and staffing and attracting, capable staff to be paid at adequate levels. I mean, that's one thing that we're seeing in many fields right now. I would have to guess that was part of it. I know it even in the early intervention program, we had staff vacancies for quite a while. We just hired somebody who's doing great, but it's really hard to find staff. Also, that the state health department sets the rates at which we pay the providers that go into do home visits. We don't control that. We wish they were higher. So there's layers here of this. But why that particular facility is closed, I don't know, but they're also saddened by it. Loss.
My question is, can we get it back? At least,
well, we're not getting anything back.
No.
What would, even if there was something new, it
but well,
wouldn't be what was there because it was run by a private company.
you call it a company, but it really was. Yes, and it was started actually by parents. Not do that enough, but the parents started the program. They hired a director. They started their own board. They did all the paperwork to get it started and funded. They're amazing. It was an amazing program. And but at least if you could do full evaluations here in Greene County, it could probably be done even at the public health nursing service. But to have a full evaluation means the parent only has to go to one place, one time. And sometimes there's something else that may need to be done, but the people in that evaluation group would be facilitating that.
So could this be run through our public health department?
I'm sure it could be if we had.
If the private organization was state or federally funded, would the state or federal funding apply to us?
Programmatically, we haven't been in the programmatic side of the house. We've been in
Right.
the side of the house to make the arrangements for parents to get the service.
We make the handshakes.
Right.
Right.
We haven't been in the business of the actual therapy, if I can use that terminology.
Mrs. Hernandez, I'd be curious to know how many employees were in this not-for-profit that it took to operate this type of business.
Good question.
Do you know? Do you remember offhand?
Right, offhand, I'd probably say about 20.
About 20.
you know, and,
It's almost spending our whole public health department now.
oh, really?
Right.
But that's including all therapists, teachers, teacher assistants.
Well,
There's, you know, a director, of course, and her assistant. And,
well, Laura certainly may be right that because of this pandemic, the
oh, yeah.
problems with staffing, but doesn't mean that staffing can't be had again, and a company like this can handle this. Maybe the word just needs to get out to the various schools, because you have teachers retiring every year, that this is something that they might like to do on the side as part of staying involved in education some way. So maybe it just needs a kickstart again to get people looking into it and seeing it. Maybe there's funds still available through federal and state.
Right.
That this company, you just have to get organized again in order to attract those dollars.
We've had a hard time for years having what we call service providers in the county. You know, that's why many times you do have to drive to an Albany or a Kingston, because there isn't an entity in the county that can address the specific infliction. Because if you think about the number of things that one child may have speech, one needs something else. So it's hard to have those providers, especially in a rural county like us. That's why transportation is the problem.
But we can do it. We did it. So, and at least if you started, and the public health has an early intervention program already. It's there. I don't know if it's probably not what it used to be. Maybe also because of staffing, but it would be a start, and you probably could get enough people just to do evaluations initially, even once a week.
Yeah, this is the first word of really getting any good information on it, so it will take some time to work through the ins and outs of it. It's, see, something with it.
I'm sure. Thank you very
I
much.
think the
Thank
number
you.
of children that need help are vastly increased also, partly because of the opioid epidemic. Some of them are born addicted.
Yeah.
And they're developmentally restricted.
Yeah.
And so they need a lot. Sometimes they'll need 2 or 3. They'll need a speech therapist and this and this and
Right.
this.
But those are the children that would come into program. They would have to have a 1-year delay cognitively to be in program. But most of them would also need, as you say, everything.
And there is an increase. I see it in the school system now with pre-K, you know, and this number of students coming in
Yeah.
that could benefit from something like that
And if you get them when they're young,
before they get to preschool.
yeah, it's the best time because you have them from the beginning. It's really the best. Thank you all.
Thank you.
Thank you.
Thank you.
And just one more thing, yesterday Assemblyman Tague held a press conference regarding to raise awareness of the dangers and warning signs of underage smoking and drug use. And I just wanted to thank Legislator True, Legislator Lucas, Legislator Bloomer, the sheriff, and our DA for being present. I did ask our partner from the Columbia Greene Tobacco-Free Action Coalition to join us at our next health services meeting, if that was okay with everyone. It's going to give us an overview of what she's been doing and what they're working on. Her name is Karen DePeister. And maybe just to bring some awareness for all of us of some of the things that are out there. We actually used yesterday something that looked like a highlighter that really wasn't a highlighter. It was actually something that they could smoke out of, and it kind of looked like this, but on the end, something pulls out and it's a pipe. So some of these things that are targeting our youth and our teens to try to raise some awareness here with all of us. We can bring that. I do. I can get
You
it.
get it for us for the agenda. for that.
Yes, definitely.
That paraphernalia is on the street, it is on
Yeah.
shops here in the town.
So just for us to be aware of it and then raise awareness in our own municipalities and communities, I think would be a big help.
And online, there's everything.
Yes, we brought that up yesterday, right, Sheriff?
Patty, I just have one question for Laura on that last contract from the state. Department of Health. Why the significant increase? I mean, did we gain that much population? Or is this for something earmarked specifically?
So the New York State Health Department had not been receiving a federal share for several years, and that changed this year. And the New York State Health Department got an increase. They re-enrolled in the federal Title X family planning program, which increased the state's share. So the state then turned around, and this is the most significant increase we've ever had. This is a surprise to me. I believe that they are also trying to increase access to family planning because of the difficulties with women accessing reproductive health care. And so my take on this is that when you have family planning programs for people to use and access free and low cost contraception, it prevents unintended pregnancies. And so I think the state should be trying to put them on the prevention. This is a prevention strategy.
You, Laura?
We know if that funding is supposed to stay at that level?
For 5 years,
5 years.
we got a 5-year grant increase, which I about fell off my chair.
Okay.
Thank you, Patty.
Is there anything else to come before Health Services Committee this evening? If not, motion.
Motion closed.
Thanks, Harry. We got it.
I'll make that. Lennon Lavera, and then Larry.
It's awfully quiet over there on that Zoom call.
Thank you. I'd like to call the order County Resources Committee at 6:22. We do have a couple people here this evening from Create, Council on the Arts. We've got the new director, Nathan McLaughlin, and our new president, Anthony DeSantis. They're here to give us an update on what they'd like to do and to see if, we can move forward with them and certainly the funds that are provided to previously to the council. So you guys have the floor. Sure, go ahead. Yeah.
Wow.
All right.
I'm trying.
Please do.
Yeah, hello. Yeah, I'm Nathan McLaughlin. I'm the interim executive director of the Create Council, joined here with Anthony DeSantis, member of our board, and Elizabeth Shaw, who works in our marketing and outreach. I'm a nonprofit professional. I've spent most of my career working with children and adults with special needs in artistic settings, most recently developing a theater program in Columbia County for the last 9 years. In case folks aren't familiar with Create Council, we are the Arts Council for Greene County. We also provide Arts Council services to Columbia and Schoharie County through our contract with the New York State Council on the Arts. And the core mission for us is to build an artistic community, right, with a focus on distribution of grant funding. And we provide that funding to individual artists, arts organizations, arts educators. We're headquartered here on Main Street. I've been headquartered at that address since the early 1980s. We're intending to stay there. And we are rooted there in Catskill. Our most recent grant cycle with the New York State Council on the Arts. We awarded 18 grants totaling about $60,000 to Greene County residents, Greene County organizations. We, like I said, give grant funding to several counties. So we are required through NISCA to provide full accounting of that. I just want to assure everybody that the funding that we have that we give to Greene County artists or receive on behalf of Greene County artists stays in Greene County, and we have excellent reporting for that. We have an internal software system that tracks that. I have a grant administrator that handles the application process and the reporting of that back to New York State. Looking towards the future of Create, we had a difficult time coming out of COVID. I've only been with Create about 6 weeks. I'm really there to help us rebuild and look towards the future. A big part of our future is board development and advisory committees. Our advisory committees are really important because they also have a county-centered focus. We are doing a renewal of our community events and workshops in our Create building. We have a gallery there. We also have a performing space and office space. We're going to be relaunching our Ruben Garcia Fund. That's an exciting fund because through New York State funding, we can't give funding to students. The Ruben Garcia Fund is focused on high school students in Greene County who are interested in arts education. We'll be relaunching that fund later this fall. We're also exploring a partnership with Columbia Greene Community College that will focus on the graphic arts program. The graphic arts program has a real focus on employment. It's a very employable program. Folks have a high employment rate. So we'll be working with them in the coming weeks to develop a program, a collaboration. And our relationship with our state agency is strong. We're in the middle of a 3-year grant cycle with New York State Council on the Arts. They're happy with our performance. They look forward to a long relationship. What brings us here is what has been known as the Community Initiatives Program and our need to make sure we have a diverse base of funding, right? The New York State Council on the Arts expects us to have a variety of funding streams, state funding, county funding, private donations. So we're here tonight to discuss the 2022 Community Initiatives funding. That's a $40,000 re-grant program that we have administered on behalf of Greene County for many years. And then to just propose our application for the 2023 funding for that program, which has also historically included an operating grant.
I've spoken to a couple of you. I think, first of all, we're all fairly new to this particular organization. And my family's been here since the 80s. I came back about 5-6 years ago. I believe in Greene County. I invest in Greene County. All of my business is in Greene County. I care about Greene County. I love that our building is on Main Street in Catskill. So I'm excited. You know, you look around right now, what's going on. I actually, at your recent event, sat next to Anna Marcoux. And apparently I volunteered to lift the cats onto the stage at the upcoming auction. But the cats are an example of what the arts bring to our community, business-wise, investment-wise, investment not only financially and economically, but also culturally. People come here to see the cats. People come here for not just the scenery, but the arts as well. So Foreland, if you had asked me 2 years ago if the Foreland model was going to be successful, I would have said, I don't see it. But she sold out all of those art spaces almost immediately. So there is a need for the arts in the area. So what we want to do is give to the artists in our community to improve our community, not just creatively, not just as a community, but also economically. I'm a businessman. I want my local businesses to do well so that my tenants do well, that they have job opportunities. For me, it's all a circle and it all fits together. So I care about Greene County. I will never invest across the river. And I want this area to do well. And so a part of this is the Council on the Arts. Wherever the arts do well, the communities do well. And I want us to benefit from that. So I'm proud to take on a tradition. We have the exact same goals and that Kay Stamer had when she founded this 40 years ago. We're on the same page. I think Kay talked to some of you about, she has ideas about 2022 and getting those funds to the organizations that historically have gotten them from the county. She's happy to be involved in that. But whatever happened during the pandemic, and I'm in multiple organizations that suffered during the pandemic, both Rotary, I deliver meals to seniors, and we don't have enough people right now to deliver the meals on the mountaintop, so we're taking the entire month of September off. This is happening in lots of areas. So I wasn't there, but I understand how you might have some issues with what happened over the past couple of years. I understand we didn't complete the application process last year. None of us were here for that. We understand why, and we're willing to do whatever it takes so that you feel good about us being the entity that takes the funds and gives them to our local artists. So I think I think we're in a good spot. I think we're building back up. We're about to do some board development. So bring some more people in. Actually, Anna Marcoux also volunteered to be on the board immediately. So I think we're in a good spot. We're asking for you to understand that we stumbled a year ago, but now we're getting our feet under us and we're ready to move forward and to continue the mission that Kay carried for so many years.
Well, I'll give you a little my history with Create, which I was on the board twice when it was GCCA. So Kay Singer was actually one of the first people I met. Some of you know me from having my shop on Main Street, Lovely, which was literally smack next to the Arts Council. I moved to Catskill in 2010, and in 2013, I opened a shop that I carried independent and local designers and artists, and it's that 2-story shop. So I had a little art gallery upstairs. So immediately when I moved up here, I joined the Greene County Council on the Arts, mostly to want to meet people, but also I just thought it was a great organization. Any of you in this room, and I think most of you probably know Kay, she can be very persuasive. And from the minute I opened my shop, she hammered on me to be on the board. So I told her the first year of business I couldn't, but by next year I was on the board. So was on the board a couple of times. So I really got to know what Create did. Like I said, I joined as a member first, and then just a better understanding of what a re-grant organization does and how it does take monies from the state and the county and private donations and puts it into the hands of local artists. So being in Greene County right now and just seeing, and now I will say that they reeled me back in March. I agreed to come back because I do still believe in the arts organization. And, yeah, I saw that they basically said, hey, Liz, we had this whole turnaround during COVID, we're building back up again. And I said, great. I said, that's fantastic, because I don't want this organization to fail. I want it to thrive. We've been, it's been here, 47 years now? I think we're on maybe here 47. But that's huge, and we've done so much, for the county, as both Nathan and Anthony mentioned. NISCA has its, doing re-grants for Schoharie and Columbia. But, we started out as the Greene County Council on the Arts, and, there is a love for Greene County. There's a huge arts community. Some of you also know me from my time at the Greene County Chamber of Commerce. I have an understanding of, there's mountain towns, valley towns, and river towns, and there's, so many different things happening there, but we have artists all over this county who are doing amazing things. And when I first came back working with Create back in March, one of the things I re-upped was the newsletter that we send out every Tuesday. And I actually added a focus on grantees email blast. If you don't get our email blast, please sign up on our website. We are createcouncil.org. But I did a focus on grantees, and it was actually a great learning experience for me to see. I focused on the 2021 grantees because their completed programs were handed in, and I started to really read what the grant money went to in the different counties. And we have some fabulous things that have been happening here because of the re-grant monies that we've been able to supply to Greene County. And some of these programs have been going on for years. Some are new artists to the area, but it's a great mix of things from community. I mean, everything from theater to art to kids programs. It's very diverse. So I can't speak enough about why I think, we really need these funds, and we need the support of the county. Without local support, it's hard. I'm working on marketing and outreach. We have a bunch of donors who the last time they donated was when we had the Beaux-Arts Ball up at the mountain. We haven't been able to have that due to COVID. There's so many things that we haven't been able to do because of COVID. And like we've been talking tonight about your different organizations and staff turnover. So now we have, Nathan is our interim director. We're building up the board again. We're doing some more outreach. I'm on board, and I'll stay, as long as they need me to do, but I really do have a commitment to Create and a commitment to Greene County. So I hope that we've expressed that to you tonight.
But we really didn't want to see the grants go away. I mean, we were actually in the process of renaming it the Greene County Cultural Fund instead of the County Initiative Funds. So I think, having, Nathan here and Anthony and Liz here, come back and explain this to us. I don't want to speak for Sean, but I know Sean has reached out several times over the last year, asking for the former executive director to come and present to us. So.
And I know a lot of the funding has not been handed out, at least not until very late in the year, and I heard some complaints about that as well.
That's why we kind of took it upon ourselves to do those
We've already
two,
handed out, what, 3 of them this year?
right, the Michael J. Quill and the Historical Society.
That we did on Bronx.
Right.
Because they hadn't been
The
done.
Bronx.
Right.
You know, they were gonna lose that funding otherwise.
Yep.
So once we were aware of it, we could go ahead and so get that funding ourselves, but it's not something that we really want to do.
Kay's proposal was that you take the list from last year, and you, aside from the people who've already gotten it, and a couple of people that she actually had a quibble with. The community center obviously is no longer viable, but she suggested that those people get either all or part of what they had gotten last year. It's too late to do an application process. She's happy to be involved. She thought that it should go out either under your letterhead or our letterhead. But that's fine with us as well. We're ready to go through the correct process for next year. So we'd love to get that money to, again, it's not for us. It goes to the artists.
We wanna
So
get
we'd
it to
love
the
to get it
artists'
to them
hands.
for 2022. That was Kay's suggested solution. We're okay if you're okay.
And, you know, I think one of our big problems when this changed from the Council on the Arts to this create group and adding in this area in Columbia County was to make sure that the money that was earmarked for Greene or that came from Greene was going to be reinvested here.
Right, stays in Greene, yeah.
Because as far as I'm aware, Schoharie and Columbia still do not put into the budget what we do.
Not the same amount. Columbia
Correct.
does contribute.
Yeah.
And we actually have a plan for SCO to get sort of an in-kind
Yeah, I
contribution.
think Columbia did last year finally.
I think I'm getting this.
Shall we be happy to come quarterly, whatever sort of good you need, if there's any important, you need to make sure that you see a Greene County money.
Yes.
Well, I think too, you know, with the lack of management in there, managing where these funds went to make sure these funds are being used for what they said they're being used when you're dishing them out, that was lacking. So when you're talking about public funds, you know, we need to be damn sure that there's an accounting of where these funds are going and that they're being used for the specific purposes. Otherwise, you lose faith, the public loses faith in you.
Yeah, no, I agree.
Oh, 100%.
So
Yeah.
we felt it was better to say, wait a second, we gotta hold on to this. And I know, understand Kay's reasoning, but you should review that the organizations where these funds may go to are actually, they have their wheels going again. That this isn't just going to, you know, sit there in their, you know, desk drawer or whatever, that they're actually using them. That's really the big thing for myself anyway.
I'll say in the past, I voted against getting this money. I'm not against the arts, I'm not against the program, but I did that because we got very little information on where all this money went the previous year.
That's where I come in.
I think we need, I mean, we got a vague,
You're throwing yourself under the bus.
I know,
we got a vague
Yeah.
sheet that said Greene County had 11 art projects sponsored. Columbia County had 5. We had 2 art shows. I'd like to see more than that. I'd like to see how many artists were sponsored in Durham, how many were in Greenville, how many.
So the focus on grantees that I mentioned before, that was one of the great projects that I literally created it myself. But it was, like I said, it was such an amazing learning process for me because so each newsletter was, each county I focused on one grantee. So, you know, I put like who they were, their contact information. So all the grantees have to submit their final project to us. So I was able to capture that from a program, and they had to answer certain questions of what they did. They also had to supply the advertising materials and pictures of the final project. So it was sort of like the proof of the program, but it was great for me to learn about these things. So that is required of them. And as a, you know, with Nathan aboard and before he came aboard, I discussed with the board of directors that, you know, there needs to be, like, we need to be going, if they're having a specific project or a concert or something like that, there needs to be somebody from Create representing and going there to make sure, you know, but also for support, you know, that this is happening, but also have some kind of documentation that these things actually took place. So there is, so like I said, there is a documentation process, but that's something that, you know, we can follow up on, and we can absolutely then present to you and say, these are the grantees, these are the projects that happen. We now have, the resources to do
Yeah, I
that.
think we'd like to see that.
Yeah,
when you
sure.
come to us, like, when you come to us next year,
Yeah,
bring in something.
Hopefully.
An
sooner than
overview, it doesn't have to be totally detailed, but like an overview, not a vague list.
I agree, and that, to speak to both that point and your point about public money, that's certainly something that was lacking. I'm coming from an environment where I was managing $2 million in Medicaid. And we definitely had to show down to the dollar where that money went, and you don't need that granular level, but reporting back on where public money goes is important.
Well, just a quick suggestion, and we didn't really see that the last couple of years, and maybe even upwards of 3 years, once Create was established, is let us know the events that are going on. I mean, you have a sub-board here of 14 people that represent towns that these things may be going on, and they kind of can be verification if one of us can make events throughout the county in the local towns or
We
something.
can do that, yeah.
It kind of is.
Oh, good, yeah, if you have, again, there's 2 ways to do that. You can sign up for them, or if you would, is there one person I should send it and then you could send it out to all of you, or what's the
You
best?
could let our board clerk know and she can send out events going on.
Oh, that's great.
It's really
Oh, I'd
great.
love to do that. That'd be wonderful.
Just,
Great.
just,
So
Mike, can I say something, please?
Harry.
Yeah, I agree with what Mike said earlier. If we're gonna start handing out money to these organizations, we better make sure, like Mike said, that these organizations are up and running, that they're just not gonna, take the money and put it into their account. A. B, as the chairman said, with our money in Greene County, we weren't convinced that it was being spent on our Greene County projects, and that's where our big issue came into. C, communication was very important. There was none. Absolutely no communication. Only when we ran into a problem, they came in to try to explain the issue. Greg Davis states that we don't need any kind of heavy lift report. I'd like to see a quarterly report, frankly. If we're going to be putting the money in again, I'd like to see where the money's going in Greene County, what organizations and how much they got. I don't think we could be loosey-goosey on this. Again, we have to have an oversight. I have no objection to what I heard here tonight. Going forward, I think it'd be a nice plan, but I would like to see some more quarterly reports and what we're actually doing with Greene County organizations.
I think that would,
I don't want to sound bold or anything. It's not that I don't care about Schoharie or Columbia, but we have a job to oversee Greene County, and I think that's the big issue.
Well,
Thank you.
The building's in Greene County, and so we're the flagship. They're gonna come to us. We're not gonna go to them. So the reporting, I think we're very familiar. We've got to make that similar reporting to NISCA because they say, you get these funds for this and these funds for that, and we can't commingle them. And frankly, part of the pressure from NISCA to make it, as you know, government organizations like regional approaches, part of their pressure was Schoharie commingled at some point, in my understanding, and they will never be a re-grantor on their own. So they require our help. So keeping that separate, the funds separate, they can't be their own re-grantor organization. So that's part of why they ended up folding up under us. But we are the flagship. We have the building on Main Street. We bring the business to Main Street. We're Catskill. Great Cat.
Anything?
Well, again, can we? Again, can we see if we decide on this process going forward? We see something, a quarterly report. Maybe you guys could come in once every 6 months, explain to us like we used to have. We've lost all communication, basically.
Absolutely.
that sounds great.
That's all.
Yep. Happy
Thank
to do
you.
that.
Thanks, Harry.
Thank you. Thank you very much.
Perhaps we start by, they've already committed to see me once to get here tonight. Perhaps over the next 60 days, we schedule another meeting we review a budget, I can then present the budget material here to you as well. So we can reconstitute the relationship with the new requirements.
Thank you. So what, I just have a couple of questions. A, what happens if this does not happen? What happens to create, what happens to Council on the Arts? If we decide, you know what, we've tried this and it has not worked for us, and we're just gonna take the funds and do our separate ways in Greene County.
So we remain in New York State Council of the Arts Council, right, with the mandate to be a rebrand organization for them for those three counties, and we're committed to that work and we'll continue on.
Okay, and the second question, Sean, have you committed anything to the people that were offering to do this for us?
That was a historical society, wasn't it?
Right.
Yeah, we just gave the two facilities, Quill and Rock, is what we've done.
Right.
It was the same dollar amount.
We did that.
There's no.
We did that, yes.
Were we gonna do something for the Hunter Foundation
Yeah,
as well? Or what did I bring up that there should have been another one?
Yeah, I don't think that was done yet.
No, we have not done anything else, no.
Oh, okay.
But we just re-granted that money for the existing allocation that we have today, which was equal to the same contribution that they received previously from the council. We gave it to the council cut the check, rather than this year, we just cut the check directly.
We didn't do an agreement with them to.
No, we didn't do any.
It was stopgap, it was stopgap funding. When the Bronx came here, they said that they've already committed programmatically, and they didn't want to wait from a cash flow perspective to have this thing reinvented.
Well, we hadn't gone past that point where.
So I think we were talking as a group about then establishing this, taking.
A new regime.
A new regime of Greene County Cultural Fund, so still allocating the money for the arts and Greene County Cultural.
We're not looking for it to go away.
Right.
Yeah, we were looking to hand it out and
Oh,
Okay.
put it out where it belongs.
Kay, I think everybody
Kay
is
is
a fan of Jonathan Palmer. Kay said that he might have wanted to be interested, so I contacted him. He's like, "Oh, you guys go ahead." I love Jonathan. Happy to talk to him any day of the week. He's on board as well.
And we like the new name. Kay had mentioned the new name to us, and we like it.
We're good with that too.
Thank you. Contact me again, next couple of weeks, meet again.
Thank you.
Anthony, do you think you could send our clerk, when you guys are having your next board meeting?
We have the next quarter scheduled. We can send those dates.
Okay. All right. Great. Anybody else?
Thank you.
Thank you, guys.
Thank
you for coming in.
Thank you.
Appreciate it.
Guys and gals.
Thank you. Thank you.
Okay, we have two action items here before us tonight. One is appointing member for our Columbia Green Workforce Development Board.
Overbaugh.
Motion, Overbaugh, second. True. Any discussion on this one? All in favor? Aye. Opposed? So carried.
I would
Next
like
one's
to
in-
just say that we had our first Economic Development Corporation meeting this afternoon with James, and he seems like he's really on board and really sharp. He's got a lot of good experience. And so we're happy to have him with us and also with the workforce development.
Thank you, Linda.
You're welcome.
All right, second resolution here is appointing member to the New York State Environmental Conservation Regional Advisory Committee. It's our own Warren Hart.
Overbaugh.
Second, Overbaugh. I have a question. I know we had spoken about this, about having someone in economic development or planning as opposed to someone from the private sector. Now, I don't know if there was any confirmation on regards to, is it preferred to have someone who's from the county in planning or economic development as opposed to someone from the private sector?
I'll defer the board.
I have no objections to someone from the private sector. As you know, we're without a planner.
Yep.
And the resolution has been on hold for quite a while.
Right, that's my point, my whole point.
So I put in my name because we want to make sure that Greene is represented
Absolutely.
first. But if there's another
You can consider it a temporary seat if you want to.
Well, I just know that in previous history, when they go through this whole redesignation on conservation lands and everything, I was involved up north with it and their classification, where I was not a fan of them shutting off state lands that's owned by the people of the state of New York to people of New York.
Ideally.
All in the name of some greater good, so.
Ideally, Mike, we would have a government and a business representative from each county. I'm not aware of how the state is selecting participation in this particular advisory.
Okay.
I just concluded the Catskill Advisory Group, which was an enormous amount of work for 2 years for the work that that board did. And I can tell you that government representation at the table was super important to make sure that the planning and economic development needs of local government were adequately represented. That group had a lot of environmental interests on that. So I don't know the mix of the board yet. Once I know that, we could probably change designation if we needed to. But it is timely, and we wanted to make sure that our name got put in so that the county would be represented.
Okay. Understood. Thank you, Warren. Anybody else? All in favor? Aye. Opposed? So carried. Anybody else with anything to come before county resources? Motion to close.
Motion.
Rivera,
Second.
Overbaugh. We are closed. Thank you.
Stop. Yeah, all of us yawning.
Good evening, everybody. I'd like to call the Public Safety Committee to order at 6:52 PM. With us, the Emergency Manager, Dan King from the 911 Center. Dan?
Busy guy this month, last month, every month.
Good evening, just a few updates. So out of the 911 center, some our call volume. EMS calls for August were 596, fire calls 216, and police calls 1,521. So compared to August of last year, EMS and fire are basically on par, but the police calls were up by 200. The nice thing is, though, the other unknown category, which is people calling to report a box blowing across the throughway, those of you that were there for that. Those are actually down by about 250, so that is a nice change. Some things coming up. Remember that on Sunday, September 11th, we will have our 9/11/line of duty death ceremony at the Emergency Operations Center at noon. So that's this coming Sunday. There is a name being added to the law enforcement that I believe the sheriff will, speak on. Hazard mitigation. So you've all received numerous emails from me and some text messaging as well. We are in the middle of updating the hazard mitigation plan, and there's a resolution is before you tonight as well. We did have a meeting on August 29th in Wyndham. That was the first community outreach meeting, which was fairly well attended, and actually had some really good feedback from the officials that were there. So the next two coming up, September 13th, Catskill at the Senior Center, and September 14th in Caro at the Emergency Operations Center. Both are at 6:30 p.m. This is a chance for officials and community to provide input on hazard mitigation concerns, any thoughts. The mountaintop meeting did actually bring up things that we had not even thought of before. So that was good on one hand, bad because it means I got to go back and do some more planning. And then, EMS wise, it has been very busy. I'm going to let Sean give a brief update here on the mass casualty incident that we had. But overall, the hospitals being on diversion continues to plague our EMS units. So it continues to be a problem. And That's it for my report. Any questions?
Yeah.
Yeah.
I know a few weeks back, our senator, US Senator was over there at Columbia Memorial speaking about some of the issues going on with hospitals. I mean, what came of it? You know, was there any information provided?
So the issue is staffing.
So
It's across the, it is a staffing problem.
So
They don't have staff.
the staffing is basically from the COVID vaccine mandate and the thousands of nurses that said no and left.
I don't know if that is the cause of the staffing problems now. There are not enough staff. So during COVID period, we had people leave nursing. We had people not go into nursing or any medicals, not just nursing.
I'm
It's
just,
all
I would,
fields. And it's not just CMH. So Albany Med, but Sean Ellis, right? That's recently we started getting their diversion notices.
yeah, I mean, it's gonna be
St. Peter's has been back.
Same
statewide. I
Yes.
mean, because they let go 35,000 nurses. They basically gave them the walking papers for them.
Can we find
Alright.
out how many of
And
our,
then these bright managers in these hospitals decide to pay traveling nurses 3 times what they were paying their regular nurses. And now they're telling us they're in financial distress. Kind of simple to see. And I just don't know if that was even talked about over there.
I'm not part of those. I'm just telling you what's going on.
I didn't know if any of you made it over to something like that to see.
I'm just
What they
talking
were
from the
talking about.
operational level, what we're experiencing.
Yeah, I think it was a miscommunication there. And I wasn't involved in it, but the media reports, it suggested it was a union problem. And I don't think it's a union problem at all. It's not a collective bargaining agreement problem. It's recruitment, retention, and I think every agency, every industry, we have an 8% vacancy factor, right here in the county.
well, that's what I was going to ask, because I know recently CMH basically told our ambulance that they couldn't bring any patients there at all.
Right.
So how, can we find out like how many employees or nurses or
How about if I ask?
shortage?
How about if I ask Jay to come to a next committee?
I think that's
that
a
would be
great
great.
idea.
Yeah, just so we have an idea, you know,
I'll get Dan
what
out
they're
of here
facing.
a little bit.
Because it's a big problem, especially, you know, that's our only hospital here.
Over there.
It's
Well, over there, but it also serves here.
you know, I do hear now much more often, since you guys started with your procedure to let PMS agencies know that there's a significant wait time somewhere. And I do hear that significantly more. At this point, we hear a lot out of Columbia Memorial with a 2-hour or a 3-hour wait time in the parking lot.
And that's the only facility that notifies our 911 center unless they are on full diversion, then we get notifications from other hospitals.
Also, each time you will be notified by Columbia Memorial.
Columbia Memorial has
Probably
agreed
heard what
to notify us when they are experiencing backup and extended wait times. Usually they're pretty good with it, but things can happen so quickly that sometimes we.
And the other hospitals, so while CMH is our biggest problem because we take most of our patients, Albany Med, we recently had a mass casualty incident on the thruway, and we're literally shopping around for hospitals that would take these patients.
How many
So-
lives are lost while ambulances are waiting?
Would anybody know offhand, did the state drop this vaccine requirement to be working in hospitals?
No,
Or,
not for healthcare, not that I'm aware of.
so that's still
For
in
mass
place?
transit today.
Mask mandate.
For mass transit.
For mass transit.
Not for healthcare.
But the vaccination
the
mandate is still in effect.
I believe
For the healthcare.
that is correct.
That's brilliant.
You're not gonna solve any staffing problems until that's gone, I can tell you that right now, it doesn't take a rocket scientist to figure that out.
Yep, that was a brilliant move.
And it was in the beginning about a union, because I know people who are nurses, and they were looking for $1 more increase an hour, the union. And these hospitals balked at it. And then the vaccine mandate, 35,000 leave, and they're paying 3 to 4 times what they would have paid their local nurses. the traveling nurses, try to fill these positions. And they can't get enough traveling nurses.
And
So,
that's causing our ambulances, right, to stay over there or?
absolutely,
So they're out of
100%.
Longer out of service time.
Do you want a little?
Go ahead, Sean. This is your realm.
Well, hang on, before Sean, come on, Sean.
Yeah.
Before Dan sits down, I would like to recognize that Dan recently attained the new highest level of emergency management certification in the industry. I'd like to congratulate Dan for that. You may explain.
Good job.
No compliments, embarrassing. Yeah, so I completed my certified emergency management designation through the International Association of Emergency Managers, which is, the elite credentialing entity. So it involves a lot of documentation of all the things that we do, but it's planning, training, exercises, community engagement. So there's a lot of different elements that go into this. And there's only about 2,500 of us in the country, actually in the world, because it's an international organization, but most of them are in the US. So, it will help us as we move forward towards the accreditation of their emergency management programs. And it's just a huge, personal milestone for me.
You were never allowed to leave Greene County.
Exactly.
So like salary negotiation? Any questions for me before we can beat up on Sean?
Before we get into the MCI incident, to answer a little bit of one of the questions that you guys had with the backups and the ambulances, it is helpful when we know ahead of time that Columbia Memorial may be on extended wait times. Most of the time lately, myself and most of my colleagues, while we're on the scene, we're calling over if a patient wants to go there, talk to the charge nurse or physician that's over there, and they usually keep us in the loop whether they can take it right away, whether we're going to be stuck, and then we can decide on alternative destinations. Not necessarily getting stuck in the parking lot as much lately because we are going other places. But what that does is streams the system on unit production or productivity of those units getting back in service in a timely manner, because now we're traveling 2 to 3 times farther to find a place to take them. I'm trying to get the numbers together through other agencies, but there is a local ambulance service. We ran some ballpark numbers the other day for 2021, just looking into Kingston Hospital. That service transported 38 times in 2021 to Kingston Hospital. This isn't counting any of the other hospitals. 2022 so far, that agency, as of 2 weeks ago tonight, has been to that hospital 130 times. 96 of those times since May, and that's right around the time that Columbia Memorial was experiencing increased wait times and capacity due to whatever their staffing issues may be. So now if you're figuring an extra hour and a half turnaround time on a call, that's a significant number. And there's times we have units that'll go to Cobleskill, Oneonta, Albany Med. Albany Med's changed their flow a little bit, so they're fairly accommodating, but most of the times when we go out there with an ambulance, we're going through the triage section, a whole different area, and we're not always going right into the emergency room. They've done something to progress their patient flow, which is good. But it, like Dan said, it's not unique to one hospital. It just happens that we're one hospital in a 2-county area that can take the surges, and it does quite a bit of backup.
So Sean, would you know if that other areas besides Columbia County and Greene County are diverging their ambulance to Columbia Memorial, and then we're being pushed out because of that?
I doubt that. We don't hear of that. But most likely with them being on so many backlogs of ambulances out there, the word gets out that most people probably wouldn't come in from out of the area to there.
They're not a trauma center, they're not a stroke
Yeah.
center.
Right.
So as far as the MCI, it was 2 weeks ago tonight. I was returning from Kingston Hospital on a prior call. We got dispatched for a bus of unknown type bus rollover on the New York State Thruway, and it took a few minutes for the dispatchers with multiple calls to determine, is anybody injured, how many are injured, what's the scenario. Initially, we had 2 ambulances, two county paramedics responding to that. And then when the fire chief got on scene, confirmed that yes, there was 14 patients and up to 6 of them critical. Our 911 center reached out to Albany Medical Center, who was the regional trauma center. And our initial response that we got back from whoever they were talking to at that emergency facility was, we're at capacity, we can't take any. In which my radar went up and said, okay, Columbia Memorial's already on backup. Where are we going? One of our other paramedics got a hold of Columbia Memorial. It was stated, we could take the 1 patient with a broken leg as long as this and this and this criteria is not going on as well. Needless to say, 2 of those criterias were met on that patient. Therefore, CMH was not an appropriate facility that could accept that patient at that time. Thankful throughout the entire community of Greene County, many agencies had members that were off duty, came in to staff additional units. So our initial request after those first couple units is we had Bethlehem dispatched with a unit, Caro with a 2nd unit, Greenville with a 2nd unit, Durham pulled the 2nd unit in to cover in the center of the county. Wyndham Ambulance's ALS unit was moved to the town of Catskill to cover the valley. At this point, still not quite enough ambulances, and we're wondering if we can't take them to a local hospital and get that unit back to take more patients, we could be facing an issue. Luckily, we ended up with, I think it was 16 or 17 ambulances out of a 3-county area. Every patient was off of that scene within an hour to an hour and 15 minutes. The last patient was on their way to a hospital.
4 trapped.
4 or 5 initially. Luckily, by the time I got up there, luckily no major extrication, but yes, they were somewhere extricated out of the vehicle. 4 were really critical. They were off the scene within the first probably 10 minutes of EMS arrival, which is to have that many units and that much community backfill to come in and do that is commendable, and it's not something that happens on a day-to-day basis. If it happened every day, we could take the extra hour every day. Exactly. But, so that's just where it could have an effect with these hospitals being backed up. They claim they're working on their issues. Albany Med did accept up to 6 patients out of that. So we also took some more to Albany Memorial, St. Peter's, Kingston Hospital, Northern Dutchess Hospital. But our next available trauma center, if we had more criticals, would have been Mid-Hudson Valley Regional down in Poughkeepsie. That would have been able to handle a higher level trauma, or Bassett out in Cooperstown, which is for minor trauma stuff.
All 5 EMS trucks.
Yep. 5 Greene County paramedic trucks, 2 Catskill ALS units, and a Wyndham ALS unit was helping cover. 2 units out of Columbia County were standing by in Catskill. A 3rd one was on their way back from St. Peter's, stopped at the scene to make sure there was no more patients. And we ended up having a total of 3 Ravina ambulances, 2 on the auto accident, 1 diverted to another call that came in the Coxsackie area. We had 1 Bethlehem unit on the scene, 2 more standing by, and Albany County Sheriff's Office sent 2 full ambulances now. So that was a scenario that would not happen often. It's just time of day and community involvement. Everybody came in to lend a hand, and I'm surprised how smoothly everything went from the initial 911 center to the fire and EMS, and just the interoperation of everybody involved.
Well, please thank the people that came in off duty. I mean, that's.
Okay, man, okay, I was dispatch.
Yeah, and
Communication was excellent.
actually, and they even had a 911 dispatcher that lives local that called up, says, need help, get in. That was pretty much the conversation there, and they came in and they handled it amazing. The group of guys and ladies that were on that night did very well. I never would have pictured that going as smooth as it was in the middle of the week. So, but yes, the hospital issues, we're hoping that something changes soon.
It just would be interesting to see that when you had stated that when you called Albany Med or whoever did that they were at capacity. Did they have to lower their capacity because of staffing shortage, or is there that many people in the?
One of the docks, I actually had 2 Albany med surgeons or Albany med physicians on their way to the scene in case they were needed.
And they pulled their emergency plan.
One of them called back and said, no, we are your trauma center. You will take those patients. End of story. That was basically.
Yeah, and they cleared room, brought doctors down upstairs, so luckily it worked.
So these backups, is this because of not having enough nurses or not having a space to put them in the building?
A lot of them seems to be admission capability because of nursing shortages upstairs. So they're backlogging in the ER and that capacity.
So they have rooms available, they just don't have people attend them.
Right, it's bed space, they can't fill the rooms because they don't have the staff to fill the room. Right.
But to have people in the emergency area to, so are people going out to the ambulances then and helping people?
Maybe, but,
Okay.
and on that note, county's playing the music. Okay, any other quick questions?
Thanks, Sean.
No, thank you, Sean.
Okay,
Thank you.
no problem.
Thank you, guys. All right. Next up, Sheriff Kuzminski, his monthly report.
And of course, everybody knows about the transfer station fires. That was also a huge
Yeah.
response, well, from both the and Greene counties.
Good evening, everybody. Somehow we actually ended up on the thruway there too. Helping out. I'm not sure why, but we're out there. So for the month of August, we had 69 civil attempts, served 195 civil papers, issued 242 traffic tickets, investigated 17 traffic accidents, made 33 arrests and 1 DWI arrest. We handled 544 calls for service, made 215 traffic stops, and issued 1 Narcan rescue kit. On August 1st, the starting jail population was 34. As of August 31st, it was 38, the high for the month being 40. Corrections officers did 36 transports, traveling 1,375 miles, totaling 56 and a half hours, moving 41 inmates. We have 1 state-ready inmate in our custody. Provision has been delayed with the installation of our body cams with no projected dates yet on that. Captain Quinn and myself attended the threat assessment training in Albany, which was presented by the Rochester Threat Assessment Center. We are getting our MOUs back from our community partners, and our first meeting is scheduled for next month. The one thing I wanted to mention about our office this month that really was outstanding was due to the state's change in the laws regarding the firearms permits, the volume of work done by our pistol permit division dramatically increased in August. Andrea and Ashley took in and processed over 300 applications, and were able to get 220 completed and through to the court. The 80 or so that didn't make it were due to the applications not containing all the required components. So I just want to recognize them for their extraordinary commitment to assisting our citizens and assuring that everyone who was able to get their completed applications in before the deadline of August 31st was able to get their pistol permits. So kudos to them. Thank you. And as Dan alluded to, we did, it was brought to our attention, there was a corrections officer, his name was Pasquale Miller, who passed away in the control room of the old jail back in the early 80s. I don't have the exact date with me, but we did contact his widow, and she's going to attend our memorial service on Sunday. We're going to transport her. That's all I have for this one.
Pete, what involves this threat assessment class or training? What is this about?
So what this is, Rochester started one in the state about 2 years ago now. We had heard about it at a sheriff's conference back almost 2 years ago, and we were trying to come up with something. It's basically a way to, a stopgap between when people are having trouble, such as issues in school or whatnot that are continuously potentially problematic. Once they graduate school, there's nobody, they lose track of them. And oftentimes they end up being the same ones who come back and cause these drastic incidents that we've been seeing. skip ahead there. Back 2 months ago, Governor Hochul came up with an executive order mandating that all counties come up with a threat assessment center. So, being that we had already started it, Sean jumped in on board and pushed it back to us, so we're stuck with it. And we're gonna run with it. It's not a bad idea. It's a resource basically for everybody who might have, you know, an issue, and it could be something that we could actually just point them in the right direction, link them with the right service, and potentially avoid a tragedy for them and for the community. So this is including school districts, private businesses, anybody really that, you know, we're going to get the word out there once we actually get up and running that, you know, if you have somebody who you think, you know, is in danger, you know, to himself or others, maybe you could bring them to this group, and somebody in that group, whether it be DSS or Queen Counties or MCAT, you know, some resource that maybe we could provide. So not necessarily a police intervention, but more like a resource for them to potentially give them the assistance they might need before they break down.
So did the RSOs go to this class as well, Pete?
No.
School safety officers?
No, this is really, the school districts themselves are gonna have to, so we're not taking cases on this as law enforcement. They're bringing this to the group.
Okay.
So if a school has an issue with somebody or thinks they may have, and it may be not even an issue, a personal problem that a student might have, they could potentially bring that student's name before the committee. In that committee, I said, well, you know, it's, you know, Charlie Martinez, change his name for the sake of this stuff. And, you know, he may be having issues with housing or drug addiction, you know, and some other community stakeholder in the group will say, hey, I can provide them with, you know, we can offer either mental health service, counseling.
Pretty much a collaboration.
It's a collaboration of all the resources we can get to get, you know, to get them in the right direction, and maybe just linking them back to something that they have, you know, a sense of ownership to or worth, you know, something to get them back on the right track.
Gotcha.
Explain that close to.
Yeah, no, that's
Close to
good.
right. Yeah, it's new to us, and it's new to them, and it's you know, it's another direction we're being brought in, but it's not. It's at the right place because if, you know, God forbid the event where
Avoids other interventions.
somebody doesn't go through the cracks and they get so out of control that something imminent is going to happen and we see it, then we can take the appropriate law enforcement action.
Thank you. There was that suicide prevention event there last weekend, and there was so many resources there. A lot of resources that were there. The other resources didn't even know were available here. So that was an incredible event to be at, and then watch the collaboration between those providers even happen all day long.
They didn't even know that they were overlapping in their areas of expertise. So
And a little streamlining going on there as well.
Yeah.
So that was another.
any other? Thank you.
Thank you.
Okay, now into the proposed action items. First one is amending resolution 204-22, multi-jurisdictional hazard mitigation plan update, Greene County Emergency Services.
Martinez, Rivera.
Martinez, Rivera, all in favor?
Aye.
Opposed? So carry. Number 2, authorizing agreement, Greene County Sheriff's Office with the Maryland A. Noonan School at Durham. Handle.
Davis.
Davis and Bloomer. All in favor?
Aye.
Opposed? So carry. Number 3, authorizing out-of-state travel for Daniel King, the emergency manager. Like to make that motion. Second by Handle. All in favor?
Aye.
Opposed?
Aye.
Barry,
Every time of delay.
anything else to come before public safety?
Mr. Chairman, not necessarily for public safety, but before we wrap up the meeting, I would like to make an introduction this evening. Here to my left, you were right. Kevin Forbes will be taking over for a very big shoe. Mary Jo has processed her retirement application, and we'll have a transition period here over the next few weeks. But I'd like to introduce Kevin, because you'll be seeing his face here at both the finance committee meetings on Thursday afternoon, as well as these sessions. And I welcome him aboard. I'm very happy to have him. So welcome.
I'm entertain a motion to adjourn.
So, Mr. Chairman.
Handle, I'll second it. Adjourn.